Hello there, Dr. Barrett here. I just finished up the chapter on inflammation for my new book called Migraine Relief Code. And there's just something I have to share with you right now because this is such a common misunderstanding. And I just can't wait until the book is done to share it with you. All right. So I'm going to lay the foundation, the background for this a little bit, and then I'll tell you what this misunderstanding is and how you can fix that problem for yourself. So, first of all, what the heck is inflammation, right? So, it's part of your immune system. Your immune system is there to help you heal. So, your immune system has these first responder cells. They come into a site of damage, they figure out what's going on, and they send out a chemical message to draw in more specific cells to help fix the problem, whether it's a cut or an infection or whatever. That chemical message, that's inflammation. They're liquids running around your bloodstream. And when they travel up to one of the nerves in your head, the trigeminal, they trigger headaches or migraines, depending on how you're wired. Okay? So for people who do have headaches or migraine, that damage is usually in the gut. About 70% of us have a gut problem, even if we don't know it. So they're coming into this area of damage in the gut, these first responder cells. And what do they see? They see food because the gut is damaged, and what's inside the gut supposed to stay inside the gut. What happens in the gut should stay in the gut, kind of like Vegas. And when it doesn't, when there's damage to the lining and that food can't stay in there, your first responder cells come in and say, whoa, 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 food's not supposed to be here. They send out that chemical messenger, they bring in the cells that respond, and then that response shows up as a food sensitivity on your food sensitivity testing. Okay. So people get these results back. I mean, you can have this done at like any store, you can order it anywhere. They get these results back and they're like, oh my gosh, I have to avoid 35 different things in order to heal my gut and reduce my inflammation and fix my migraines. That is the wrong answer. Let me explain why. Those food sensitivities are the result of the gut damage, right? So if that gut was sealed up, your first responders wouldn't come in, send out the signal, bring in the cells that make the sensitivity. So the answer isn't to avoid all those foods. Those food sensitivities are the result of the gut damage. And your job is to actually seal the gut lining up. Now, how do you do that? You do that with fiber, which feeds the healthy cells in your gut that help heal your gut, and with probiotics. And you can do this in food form. You absolutely should. You should eat more beans, lentils, green peas, chickpeas, whatever kind of fiber you want. You should eat more, probiotics, yogurt, kefir, dairy-free if you need to. Get some more of that stuff going on in there so you're seeding the good bacteria and giving them the fiber, which is what those bacteria eat, so that they can do their job, heal your gut lining, and then guess what? Your first responders aren't seeing food anymore, and your food sensitivities go away. Now, here's the problem that I'm seeing from people who are working so hard to avoid these food sensitivities or triggers. They end up with a list of like 35 things they need to avoid. And of course, what they're doing is avoiding the result of the damage. They're not necessarily fixing the cause of the damage. Do you see the problem here? But when they're doing that, two really awful things are happening to people. Number one, they're getting nutrient deficiencies. Now, I have tested thousands of different nutrient levels on people with headaches or migraine. I don't think I've ever seen somebody who doesn't have something, right? At least in the beginning stage. Obviously, later on, they're fixed, they're the problem solved. But those nutrient deficiencies are so common. And I'm telling you, the brain is a very demanding organ, all right? If it doesn't have the nutrients it needs to do its job, it is going to talk to you. It's going to give you head pain, or it's not going to think for you, or whatever else you want your brain to do. So your brain will communicate this lack of nutrients to you by not working right. So the solution there, of course, is to eat a wide variety of foods. So at the time when you need a wide variety of foods, what are people doing? They're restricting, not helping solve the problem. And then the second thing that happens, you guys, is that when you restrict food like this, it really sets you up for an unhealthy relationship with food. And anorexia is far more common in those of us who have head pain and migraines because we're just trying so hard to fix the problem, and we've been told to do this without, knowing the whole story here. And the death rate in anorexia is 5 times that of the general population. We've got to correct this misinformation. We can't let this go on. All right. So what I want you to do then is, if you notice this gut connection for yourself, of course, the best way to figure this out is with genetic testing. That tells you exactly what's causing the gut damage and exactly how your inflammatory signals are responding, which I got to say, in migraine is usually a little over the top. That's what the genetics usually are. And we have to tamp that down. But depending on the exact pattern that we see, we can create a customized solution just for you that also gives you a long-term strategy to reduce inflammation and optimize your health in like a million ways, not just your headaches, of course. And then, but that's an expensive and involved process. But if you want to just, quick nugget to take away right now, then eat more fiber, eat more probiotic foods, and take both in supplement form. And then at least you're taking a step in the right direction. All right. So if you want to find out if inflammation is part of what's kind of going on under the hood for you, genetics has shown us that inflammation is one of the 4 main problems going on under the surface in the body that result in the experience of migraines and other kinds of headaches. If you want to find out if this whole inflammation thing is an issue for you, go to theheadachequiz.com. Super fast quiz. It'll give you an idea of what your headache type might be, and then I'll send you a free ebook that explains it in even more detail. That way you can get started right now, totally for free, and get your body on the right path to fewer headaches and migraines. All right, everybody, take good care.